and you're watching NDTV 24/7.
Welcome back. Well, let's now focus on the COVID situation in the national capital. And is it the festival effect that we're feeling over the last 1 month? If we take a look at the numbers, India's average daily COVID cases have dipped, but the reproduction number, that's the number by which cases are, multiplied, is up sharply. So is the festival effect pushing up COVID cases and the reproduction number in Delhi? Delhi's lowest average daily cases in 2021 has been 25, but the daily average cases on Thursday was 38. So is it the festival effect that's pushing up COVID cases? And the R number, the reproduction number in Delhi, is now 1.15. It becomes something of a concern when it crosses 1.
The recent weeks of festive gatherings and crowds, doctors and other experts fear will lead to a fresh rise in COVID cases. In Delhi, while no COVID death has been reported in nearly 3 weeks now, COVID cases hit 54, crossing the 50 mark for the first time since mid-September. 2-week cases are up 521. In Gujarat, the daily cases have hit 42, the highest since mid-July, and 2-week cases are 345. However, the reproduction number has been above 1 in both states for most of the past 1 month. Above 1 indicates cases are rising. For now, cases are manageable and the positivity rate well below 1% in Delhi.
There was a lot of apprehension that the cases may go up, but at the same time we need to be alert for the next couple of weeks or months, because as we see that we've had all the festivities, cases may pick up in the coming 2 weeks or so we should not let our guard down. But as of now, there is not much increase.
Delhi's largest COVID hospital, which saw about 1,500 COVID admissions daily during the second wave, today has 6 COVID patients admitted. Yet experts don't rule out the possibility of a third wave.
थर्ड वेव आएगा तो 2 कारण से आएगा, एक ह्यूमन बिहेवियर की वजह से और दूसरा वायरस के बिहेवियर की वजह से. लापरवाही नहीं बरतेंगे तो नहीं आएगा, और यदि वायरस में म्यूटेशन हो गया, then there is a possibility of third wave.
Even though there is a dip in the overall COVID cases, experts are not ruling out the possibility of a virus mutation which could potentially lead to a rise in the number of cases. The public needs to be mindful of this in the ongoing festival rush. In Delhi, with Prem Singh, Shonakshi Chakravarti, NDTV.
Well, to talk more about all these threats to our health, we're now joined by Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospitals, and Dr. Rachna Kucheria, Founder, Doc Genie, Telemedicine, Epidemiologist. Thank you so much, doctors, for joining us this morning. So currently the situation we have in North India is we're faced by, toxic air pollution. We're seeing cases of dengue rising, and now it seems that even COVID cases are going up. The overall COVID cases are coming down, but there is a fear of the impact that we've seen of the recent festivals and gatherings that have taken place. Dr. Rachna Kucheria, first to you, what is the situation if we take a look at COVID currently? Because now doctors are talking about how they're hearing about more cases emerging from NCR.
Thank you for having me, Gargi. And I will talk about some of the outpatient scenario. My colleague, very able colleague, Dr. Chatterjee, we work together for the hospital cases, I'm sure OPD as well. But yes, in the past week where we weren't seeing so many cases or hardly any, we are picking up maybe 1 or 2 every day in a small practice, and also keeping ears on ground from doctors who see patients in hospitals. They are also seeing small numbers yet, but remember, these are indicators. The festival season has just gone by, but it's going to continue until the end of the year. So if this is an indicator of what has happened after one, I think we need to be very, very cautious that a small rise in numbers could indicate, them going up in a large way, but we need to be cautious before that. Yes, we are seeing more cases, I would say, than more than about 4 to 6 weeks ago.
All right, Dr. Chatterjee, so we now have this situation in which we were wearing masks for COVID, but now we have to wear masks for pollution. We have to tell children, to stay indoors because of the pollution, and also stay indoors because of the fear of getting bitten by mosquitoes. So the dengue situation is also very, very worrying. We've seen cases increase, especially affecting children. If you could tell us a bit about that, and also the fear of dengue plus COVID.
This time dengue has been bad again. Last year dengue was minimal, maybe because of COVID. COVID did surface, but this time we had a lot of dengue cases. The hospital beds were not available for people. It was all full. But in the last 2 days, I think the COVID cases have started to trickle in. The numbers are slightly higher. It's not worrisome still, but we need to be very, very watchful for the next 2 to 6 weeks, I would say. But yes, luckily I'm seeing that the dengue cases are slightly less than what it was about 3 to 4 days back, maybe because of the weather change. And that is what we see post-Diwali, that the dengue cases do show a downward trend. But we have to be very careful in the next 2 to 6 weeks, especially with COVID, because in between, there were hardly any phone calls or any patient approaching me for COVID. But in the last 4 or 5 days, I have been approached at least by 7 to 10 patients telling me that they are having symptoms and they have tested positive. So we have to be really watchful in the next 2 to 6 weeks.
All right. And we've also seen that dengue has been affecting children a lot this time around. Dr. Chatterjee, if you could, explain that. Why is that they're getting more severely affected? We did see this earlier in Uttar Pradesh where, there was this whole epidemic of dengue and children getting affected.
Sam, definitely. And what we are seeing also this time is the liver getting affected much more commonly than the previous times. And children have had, even although I'm an adult practitioner, I've had children admitted under me because of the number of cases that obviously the number of children have been affected more. I'm not saying that the outcome is poor if they're being treated properly, but yes, they are having more and their liver functions are deranged and a few people are having even lower blood pressure and coming with bleeding manifestations. They're all manageable if you treat them at the right time. And that's what I have been saying, that if we have the symptoms, especially with all the cases happening together, dengue, a few malaria, a few typhoid, and also now COVID coming in, it's very important that the patients consult with the local doctors at the earliest so that they can be managed. Like we have had patients from several parts of, we cater to a lot of peripheral, to the neighboring states like UP and Haryana. If managed properly, they can all survive. But yes, I would definitely agree that the number of cases affecting the children have been higher. And especially UP and Haryana, the children cases are worse than what they have happened in Delhi.
Right, and Dr. Rachna, and if we talk about air pollution as well, and this is something we see every year in Delhi, but once again combined with all these other threats to our health, today again air pollution has gone into the severe category in Delhi. It's not just Delhi, it's across North India and Uttar Pradesh. In fact, Uttar Pradesh has the highest number of towns that are facing severe pollution, and people who have respiratory issues are in danger. Everyone else also feeling some sort of allergies and itchy eyes. So if you could tell us some precautions that we could take.
Sure. Gargi, I will talk about the air pollution also in just a minute, but just to also, as an extension to what Dr. Chatterjee said about dengue and what you asked, I think the dengue has right now, dengue or Zika or in other parts of the country is right now in focus and prominence. It has unfortunately almost become a perennial issue. It's rampant right now in UP, Haryana, Gujarat. We're getting reports from Chhattisgarh, MP, Rajasthan, and generally this disease has in the past also affected children more severely. But what's happened is the number of cases are high. So the number of cases go up, you see, and there's a small percentage always that is severe. So then that absolute number goes up. So I think suffice to say, again, that, for any of these acute fevers, whether it's dengue or chikungunya or malaria, how with COVID, the prominence of both the prevention strategies and treatment, prevention being testing, masking others, treatment being having oxygen and beds available, has come into prominence. The same thing needs to happen for these diseases and others, that in the periphery, it could be as simple as IV fluids, or if you don't have it, as complicated as IV fluids to save lives for these fevers. So I think, every time we react to this, post-monsoon, this happens. I think, the year-round, the prevention, the build-up, the basic building blocks of public health to have mosquito control, to be able to treat these patients at a primary care level, to get the word out, to do the house-to-house surveillance if outbreaks are happening. This needs to be strengthened. Now back to your question on pollution. It's the same thing. We do talk about it year round. We know this happens every year post Diwali. Yes, and to save yourselves, it is again masking of, the kind that will keep away some of the particulate matter, smog, letting the vulnerable, the small children and the elderly not go out when the pollution index is high. Maybe they can only go out for a little bit when the sunshine is there. So we do end up repeating all of these every year. And of course, those with lung conditions, at the slightest indication of worsening, please do try and get some medical help so that you don't become really bad and then it's very hard to pull one out of that respiratory distress. So I would say that these things, as basic as they are, but also as hard as they are, because we talk about them every year and it's frustrating that we land up in the same position every year. But save yourselves. If you are feeling sick, get help. Make sure at least your environment, mosquito control is there. If you can use bed nets and prevention mosquito repellents, that's really, really important. Extend help in big cities, to people who work with you and around you who may not have such facilities. Educate those. Every citizen do their bit, because dengue and some of these vector-borne diseases do pass from dense urban areas to rural areas as well. And we are seeing that now. Tier 2, Tier 3 is affected. So I think the governments have their part and citizens also have their role.
All right. Well, thank you so much, doctors, for joining us this morning to talk about, all these issues and threats to our health and actions that we need to take. And I think people need to just be careful, whether it's pollution and even the rising COVID cases and, of course, dengue affecting so many, particularly in this year. Thank you for joining us.